Hello, I am Dr. O. William Brown, and this is a Society for Vascular Surgery briefing about how to negotiate a medical employment contract. In negotiating a medical employment contract, it is most important to remember that a contract is only as good as the two people that sign it. The physician should understand all terms of the contract. In addition, the physician must determine which terms are negotiable and which are not. There is no such thing as an ironclad contract. Accordingly, when you sign an employment contract, it should be with the intent of honoring it. Litigating contract disputes can cost thousands of dollars, and oftentimes even the winner is in fact a loser. Medical employment contracts are often divided into 5 major components. These usually include employment duties, compensation, benefits, no-compete clauses, and termination. In addition, contracts usually contain sections that address legal topics, including severability, applicable law, and legal fees associated with contract disputes. The physician must fully understand all aspects of the contract if he or she is to successfully negotiate its terms. Employment duties include what the prospective employer expects from the physician. This may include the number of hours the physician is expected to work, teaching and administrative assignments, as well as academic expectations. Compensation sections include a discussion of salary to be paid, as well as the earning and distribution of bonuses. Formulas for bonuses can be quite complex, and safeguards must be present in the contract to ensure full payment to the physician. In addition, this section may address if and when partnership opportunities exist. The benefits section of a medical employment contract outlines what benefits will be provided to the physician and when they'll be provided. These benefits most often include malpractice insurance, health insurance, disability insurance, dental insurance, vacation time, pension and profit sharing contributions, and moving expenses. Travel expenses, as well as specific practice expenses, may be addressed in this section. One of the most controversial and yet often least negotiable sections of the medical employment contract is the section concerning no-compete restrictions. The employer attempts to prevent the physician from becoming future competition, while the physician attempts to protect his or her right to continue to practice in the area if things do not work out with the employer. Whereas most courts require that the area outlined within the no-compete clause, as well as the time frame of the clause, be reasonable, the definition of reasonable often varies not only from state to state, but also from court to court within a given state. The cost of litigating a no-compete clause can be quite high, and is therefore recommended that if the physician signs a contract with a no-compete clause, that he or she is willing to abide by its terms. In addition, attorneys often use complex language in constructing these clauses, so it is critically important that the physician fully understands exactly what is contained in the no-compete clause. Finally, there is a section on termination. This section outlines when and how the contract may be terminated. In addition, it addresses the results of such termination. Again, it is critically important that the physician fully and completely understands the terms in this section, such as termination with or without cause. The only way for a physician to fully understand the terms of a medical employment contract is to have the contract reviewed by an attorney. It is important that the physician have the contract reviewed by an attorney or law firm that has specific expertise in reviewing medical employment contracts. A contract is meant to be a meeting of the minds, and this can only occur if the physician fully understands each and every term of the contract and is willing to abide by them.
This briefing is made possible by a grant from Cook Medical. To learn more about vascular health, visit vascularweb.org.